Coming up, we'll be on location at Sollay Cosmetic Medical and Laser Center in Baltimore, Maryland, discussing their vision for their practice and how they've implemented the latest and greatest medical technologies to help patients achieve optimum results with one of this area's top doctors, Dr. Terrence Baker. Welcome, Dr. Baker, to the Top Doctors Interviews. We're looking forward to this interview with you. I wanted to talk about the Sollay Medical, Cosmetic, and Laser Center here to talk about your vision, because you guys offer so many different treatments. You offer cosmetic treatments, whether it's body contouring, facial rejuvenation, anti-aging. You offer weight loss, and you offer medical treatment and procedures as well. Can you share your vision about the practice and what you were looking at when you set this up?
Yes. Back around the year 2000, we opened up a general family practice here in the Baltimore area. And the goal was to provide family medicine care through my nurse practitioners, who are also board certified in family medicine. And myself, I'm board certified in family medicine, geriatrics, emergency medicine, and forensic medicine. We had a dream, which was to expand the traditional model of family medicine and to add some additional services. And the first service we actually added was pain management. We saw a lot of patients coming into the hospital being referred to us who had pain from sports injuries, car injuries, getting older, osteoarthritis, rheumatoid arthritis, and a variety of painful conditions. And one thing that was in common is many of them were using medications, particularly controlled medications like oxycodone, OxyContin, Percocets, Percodans, those type of medications. And so what we did is we began using medical therapeutic lasers to treat patients with painful conditions, and we were amazed at the ability to reduce the pain and to reduce the amount of medication that they were using. Our first office was at the Good Samaritan Hospital in downtown Baltimore, and the security guard, I don't know they ever knew the name of our practice, but they always remembered it as the practice where miracles occurred, because patients would come in wheelchairs, and a few weeks later they would see patients walk out. And the reason being is that we were providing, pain management using medical therapeutic lasers to reduce the pain, the inflammation, and to get the patients back on their feet. I'll never forget one October, about this time of year, a patient came to us, an elderly woman. She said, "Dr. Baker, I have just one dream, and I understand that you might be able to make that dream come true. I have tremendous arthritis in my knees. I don't want surgery. I'm too old for surgery, but I want to cook Thanksgiving dinner for my family one more time. And do you think over the next 2 or 3 weeks that we might be able to reduce the pain in my knees so that I can stand and cook that meal for my family?" And sure enough, we brought her in 3 days a week. We provided a course of treatment for her. And sure enough, she realized her dream and was able to cook Thanksgiving meal for her family. She's one of those patients that came in through security in a wheelchair and 3 weeks later left walking to cook dinner for her family. So that's how we started. And then subsequently, we noticed that our patients needed additional services. For example, patients would come in and they would have excessive ink, tattoos, or sun damage in all the wrong places, and they were looking for a new job, or maybe they'd already gotten a job. And here in Maryland, federal and state jobs often require no visible ink. So what we did is we purchased our first medical therapeutic laser for removing ink, an Astanza unit manufactured here in the United States in Houston, Texas. So we bought the Astanza. The next year we bought a Fotona, which is in Europe, from Europe, and is the top recognized laser for removing tattoos and ink and pigment in all of Europe. And so we had the Fontana, we had the Astanza, and we began removing ink. I can't tell you how many hundreds of people have come here with tattoos on their neck, their face, their hands, their arms, different places where their new employer just doesn't want ink. And so we went into the business of removing ink. The next thing we did is we love to help patients slim down and to be smaller and fitter because every medical condition in a family practice requires better body weight. Being smaller, being within your BMI, weighing less, in general helps diabetes. It helps hypertension. It helps osteoarthritis. It helps rheumatoid arthritis. I'm hard pressed to think of a medical condition that weighing a proper body weight doesn't improve. It virtually improves every medical condition that you can think of. And so we began helping people to trim down. But then when people trimmed down, they would have extra skin, loose skin, and their shape wasn't what they wanted. So they weighed less, and they were very happy for that. They'd lose 20 pounds, 40 pounds, 100 pounds. Some people lost over 200 pounds. But they'd have this extra skin problem and didn't necessarily have a budget for surgery to do a tummy tuck or a facelift or chin tuck or any of those kind of tightening surgical procedures. And so we purchased the equipment necessary to tighten the skin up using medical therapeutic lasers. And now what we do is we help you to trim down by dieting and, of course, exercise. We help you to use medical therapeutic lasers like sculpture and UltraShape Power, which uses ultrasound waves to permanently destroy fat cells. And while we're doing it, we also recommend that simultaneously we begin a process of tightening you up. And we'll use the VeloShape by Candela to do that. And we have other pieces of equipment, medical equipment also, that can help to tighten up the skin, like Tempsure, for example, uses radio frequencies to tighten up the skin virtually everywhere. Face, neck, chest, abdomen, vagina, labia, legs, everywhere. And so, we have also have the Tempsure equipment for tightening. The next thing that happened is once we help people to trim down and tighten up, then they wanted to take some years off. For example, have you ever seen a 70-year-old face that looks any better in a man than mine today? And I'm not saying that I'm beautiful or handsome or anything like that. I'm just saying that I had a lot of acne problems as a child. But using technology that we offer here in the office, I've been able to smooth a lot of that out. And what I say is take 10 years off. And so from time to time, my nurse practitioners treat me with the very same technology that we offer to our patients to rejuvenate the skin and essentially return the skin back to a more youthful appearance, basically roll back the clock about 10 years. And there's a science to that. It's not just physically you look better, but also we actually know from dermatology studies that if you biopsy the skin after treating it with medical therapeutic lasers and radio frequency, that you actually elongate the telomeres. Now, what are the telomeres? The telomeres are like clocks. They're like cell clocks. And every cell in your body has a clock. And we're designed, in my opinion, we're designed to last about 100 years. So that's about what we're designed to last. That means that every cell in your body has a clock attached to it called a telomere. And those telomeres essentially allow the cell to know how old it is and how long it has left to survive. And that's important because each time the cell replicates, that each time it makes a new cell and reproduces itself, then what happens is the telomere shortens. And so you eventually get down to no telomere and tick-tock, 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 your time's about up, okay? But by applying energy, that is laser light energy, medical therapeutic lasers, and by applying radio frequency sound waves, we're able to roll that clock back. That is, we're actually able to elongate your telomeres for the areas that we treat, which typically is face, hands, back of your hands, your neck, sometimes in women, the anterior chest, because ladies like to wear a nice V-neck like I have with my sweater today. They like a nice V-neck with some pearls or something like that, attractive. So they like that, and they want that area to be youthful appearing and to look the best they can. We all do. So that just gives you an overview of how we have developed this practice to where we are today, Sollay Medical Center. So that gives you a little update, just a little snapshot of the practice over the last 20 years of where we started, where we've come to, some of the procedures that we do. At the end of the day, we're a general family practice that has some specialty niches that we believe are beneficial to our patients. Our patients love it. We can take care of your hypertension, your diabetes, your osteoarthritis, and We can do your sports physical for your children. We can do well child checks, well adult checks. But at the end of the day, we can also help you with your appearance and your function.
Well, I love that approach, Dr. Baker. It's a tremendous approach. I mean, you founded this practice based on the medical side of it. It evolved naturally through the process as you found other needs for patients that fit into what they were looking for and what you could provide. And you've become a wonderful one-stop practice that offers every aspect of not only health care, but cosmetic or appearance. Every aspect of a human being is tied together. And you are utilizing that approach that your health, your weight, your appearance all work together. And if you can provide all the services in one place that can help people, they don't really need to go anywhere else.
No, I think that's true. For years, family practice doctors, we help patients to control their medical conditions, starting prenatal. For example, this practice for years delivered babies. We've delivered over 1,200 babies over the years. We no longer deliver babies, but that's just because of I guess, the political environment where now babies are usually delivered in just hospitals that only do infant care. But we do take care of infants. I think our youngest child is currently 4, but we see patients all the way up to our oldest patient being 112. So we provide general medical care across the board, not only here in the office, but we also do house calls. We do some street calls to homeless people who are on the street. We also do nursing home visits and work in the hospital as well. So the practice is a full-service family practice that has several special interests. And you are right. You really hit the nail on the head, which is we can not only help you with your physical disabilities and your medical conditions, but we can help you to be the best you that you can be.
Dr. Baker, you and your practice have established a reputation for excellence, not only in healthcare and wellness in the community, but offering some of the latest and most effective treatments for anti-aging, facial rejuvenation, body contouring, weight loss, a total one-stop for patients in the community. Can you tell us what you feel separates you and your practice from a lot of the other practices in the area?
Well, I think first off, it starts with experience. That is, our staff of nurse practitioners and myself, Medessa Vasander, Hannah Keeley, myself, are a team with over 100 years of experience. We have the unique knowledge, education, training, and experience to be able to interview patients, do the physical examination on patients, do the diagnostic testing, come up with a differential diagnosis, and then treat the patient. And whether we're treating them medically for their hypertension, their diabetes, their heart disease, their osteoarthritis, we are able to successfully do that here at Sollay Medical Center. Next is we have developed the specialized education in using medical therapeutic lasers, ultrasound, frequencies, as well as the latest of technology to provide care to patients with unique needs. And we have a lot of unique needs. Patients come to us with acne and acne scars. We can treat the acne and we can treat the scars. We also do Botox and fillers here, so not only can we diagnose the acne and treat the acne medically, but we can also then go on and repair the damage using Botox and fillers, followed by one of our rejuvenation devices using either radiofrequency, microneedling, like we have the Patanza here. Patanza is a microneedling that uses radiofrequency at the same time. It's one-of-a-kind device. Nobody else has that type of technology. And we're able to repair the scars of acne. We have patients come to us with burns and injury from burns. We're able to work on the burn scars, sometimes the area from which the patient had a transfer of skin. We can improve the appearance of that skin, and we can remove the hair associated with that transplant. So there's so many things that we can do here in this office, starting with medical evaluations, medical diagnosis, and then offering to the patient the best plan, not only to treat their physical condition, but also to improve their aesthetic appearance as we want that patient to be the best that they can be. It's like the lady that came to us with osteoarthritis. Yes, we can provide her with the diagnosis, do the x-ray examinations, the physical examinations, provide medication, but at the end of the day, using medical therapeutic lasers along with medication, got her on her feet, and she cooked her Thanksgiving dinner. We do that kind of thing here at Sollay Medical Center day in and day out. We help patients to reach their goals, whether it's medical goals or it's aesthetic goals. We can do that because of our unique knowledge, education, training, and experience. Number two is we have the equipment. We have invested in over $3 million worth of cutting-edge medical equipment that provides state-of-the-art from leading manufacturers. We have 12 manufacturers represented in this office. They are all leaders in their fields. We can pick and choose the equipment that is best to meet our patients' needs, and we have. And so I think investing. Next is location, location, location. We have a great location. Virtually unlimited parking, easy to get in and out, 3 interstate highways, crossroads of 3 interstate highways nearby, the airport, BWI airport nearby, the train station. People come in from New York, come in from Boston to get treated, come up from Richmond to get treated. And so we're sort of in a hub, if you will, in a place where patients can come to get the treatment that they need. They can come, get treated, and be home in time for dinner. And that's sort of become a slogan of ours. That one of our patients who flew in from Miami to get treated, she actually gave us that. She said, well, Dr. Baker, I flew up here because I really didn't want to go to any of the medical offices there in Miami. I flew up here to get treated. I'll be home in time for dinner, won't I? And so I sort of borrowed that from her because it's true. And so patients do sometimes come because we have that unique knowledge, education, training, experience, and we have the equipment to go along with that experience.
Dr. Baker, that was very informative. You're doing great work in the community. You're helping so many patients, whether it's their medical needs, their health, their wellness, improving their appearance. Also, I want to point out that your patient care is unparalleled. I mean, you really take the time with each patient to understand their needs and to help treat and help them achieve their health goals or their appearance or whatever their needs may be. So you're doing great work. We're honored to have you in our program. And I want to thank you, Dr. Baker, for being a guest and sharing this great information with us today.
Thank you very much.